So it's time for question and answers afterwards, right? We'll give a little time for that.
Yes. And
Okay.
then a little time at the end. And then at the end, please,
you're breaking.
Panelists, please.
You're
also
breaking.
Must I text it maybe?
Yes.
Listen, so where's Charity?
Texted.
Okay. Cool.
Definitely.
Not a problem. Deny, where are you, please?
I'm here. I'm in Joburg.
I see that. Johanna, is that you? Algeria.
Algeria, yes.
And is Thelma here?
Sorry?
Yes, I'm here.
Thelma, we just can't see you.
Oh yeah, I had to mute my video because of the network. Okay,
Oh, so
there
it's
I am.
Hi.
Yeah. Hi. But anyway, I'll have to mute it all along.
Okay.
Start.
Thelma, sorry, where are you, Thelma?
I'm in Lilongwe, Malawi.
Malawi.
Yes.
Got it. Okay, perfect. Sharp. Guys, it's going to be high.
Let me leave. Bye, guys. Good luck.
Bye. Thank you, Ta.
Hi, everyone. Thank you so much for joining Breaking Down Borders Africa Virtual Youth Summit 2020. It is day 3, and today we are talking COVID-19 and the effect that it has had and will probably continue to have on adolescent girls and young women all around the world, but most importantly in Africa. And, this year was quite an important year for Beijing Platform for Action. And the purpose was really for the world to gather and how far we've come in terms of the gains made for gender equality and what gaps still. And obviously with the pandemic, with COVID-19, it's kind of thrown a huge in the works, and we haven't been able to do that. But certainly, we can't stop because of a pandemic, because we know that gender inequality bridge and hi Charity will further be worsened. Young vulnerabilities continue to become a big thing, and so we don't stop. We continue to work, and we do it through these platforms. And I want us today to chat about the effects that COVID-19 has had on girls and young, actually in 3 areas: gender-based violence. For example, here in South Africa, the rates have gone extremely high because of being quarantined and locked down, and all of a sudden, young women and girls find themselves in a space of being vulnerable. Health services, we also know in in a time of a pandemic or any global health crisis, a lot of effort shifts to whatever the world is responding to, and other health services and social services are limited. And also, most importantly, one thing that's close to my heart is what COVID-19 has had an impact on, for me, is economic well-being of girls and young women. And we know that it's going to have a major impact on them. And how do we navigate that with young women? I want this session to be, yes, about the challenges we're facing, but I want to give people the solutions. How do we navigate this time? I don't want us to spend a lot of time on the problems, okay? We know what the problems are. I want us to focus on what do we need to do to navigate this pandemic. How do we empower girls and young women to walk out of this era that we're in empowered and stronger? I've got an amazing panel that I'm going to introduce. amazing, beautiful women from all around Africa. And I'm just going to quickly introduce them before I allow our first speaker, Charity, to chat to us. I'm going to start backwards. Thelma. Thelma is in Malawi.
Hi.
Thelma, say hello.
Hello.
I also have Denai. Denai is in Pretoria, here in South Africa.
Hi.
Then we also have Hayat. Hayat is in Algeria.
Hello, girls.
So then last but certainly not least, we've got Charity. Charity? Hi, Charity.
Frozen.
Charity? Such a beautiful smile on her face. I don't even know if she's hearing us. Hey!
Hi, finally.
Yes, thank you. We're so glad you could join us. Thank you so much.
Hello.
Charity? Hello. So I think while we allow Charity to come back, what I'm going to do is I'm going to allow Denai to quickly tell us just a little bit about yourself. And so let me rather do that first. Denai works for Youth Health Africa, focuses on youth development and empowerment, which is a one-year skills development program. Denai is completing her master's in gender studies at the University of Pretoria. We like it. We like it. We like it. We're diversity and she focuses on young people's perspective on what parenthood means. She aims to use the educational background to make mental health and well-being an ordinary part of young people's conversations. Denai, tell us a little bit more about yourself.
Yes. So I think I've always been interested in gender. Just because, my interactions with people have often been on based on gender, right? And I've seen that, my relationship with women is a lot different to my relationship with men. And I've always wanted to understand, why is it so different? And not only just to understand, but also to make an impact in terms of, how can my conversations with other young women change in ensuring that, there is a lot more gender equality in, the things that we do and the way in which we interact and the actions that we take as well. So I think this is such an incredible platform because I think gender, and especially, women and young girls, hasn't been prioritized in terms of COVID-19 response. And I think that it's a very important conversation to have, and I'm really excited to contribute my thoughts and opinions about that as well.
Great, thank you so much. It's so lovely to have you on board, and we're looking forward to your input. Hayat, tell me more about you.
Well, first of all, good afternoon, everyone. Actually, it's a tremendous honor for me to be here today amongst you. It's a privilege to represent my home country, Algeria, and to share with you the Algerian context about this pandemic. Well, for me, I do hold a bachelor's degree in political science with a major in international relations. I do work in one of the world's leading consultancy business firms. I am an Algerian young woman engaged in the promotion of human rights and especially women's rights. I am an activist in the enhancement and the improvement of women's conditions in Algeria and in achieving gender equality. I always I've been actually since my childhood, I've been encountering a lot of, let's say, unjust situations where women do not, let's say, deal with the same issues as men do actually. And this is a situation where I was always asking myself about why are women facing different issues that men are not facing at the end of the day. And that's a question I've been asking myself a lot, and I've been being engaged and committed in gender equality, especially in Algeria, because the situation is not easy, and the situation does not go in the sense of the prosperity of women in general.
Wow. Okay. Thank you so much for that, Hayat. I also do know that you are you hold a degree in political science, which is quite interesting when you're navigating the political landscape of your country, which I know can be quite tricky versus gender equality. But we're going to get into that, and I can almost imagine that you've got a huge task ahead of you, which. Obviously, from your bio, it's clear that you'll be able to pull through. I'm not worried about that.
Definitely.
And I know
it's
you
not
got
that
it.
easy, yet we're trying to.
No, for sure. Thelma is an advocate on the forefront of advocacy initiatives for young women, young women's rights, economic justice, and advancement of human rights for all. I know that you have very strong views around ending gender-based violence against women and girls, and you want their empowerment to be on top of the list when it comes to priority areas. And you also do this in a special way because you do involve male engagement. You are clear that to get it done and get it achieved, you want it to be done with males involved. Tell us a little bit more about yourself, Thelma.
So as you've already said, hi everyone. It's such a great pleasure to be here and just to connect with amazing young people and young women from different countries who we share the same passion and at the same time who we also share a struggle. I think that's why I really like about this platform. But like I already said, I'm Thelma from Malawi. I am studying towards my master's degrees in women's and gender studies, and I also explore international gender studies. I am currently working on a research project of taking indigenous norms that Africa at this point, an African feminist analyst group put in place to assess the put in place to respond to COVID-19. So despite being Malawian, but I'm also proud African. So every African who is in here, happy belated African Day. It took us a while, but it's pretty good that we have to, be here and have this conversation. Pretty much I've had almost over, let me say, all my life, I have been in a position where by prejudice against, just by virtue of being female has been my main motivation to speak on or to speak out against gender-based violence, against gender discrimination. And at this point in time, yes, I'm more interested in male engagement. It's also part of my research, but at the same time, it's something that I've worked on. And I feel like despite having the gender conversation, we're missing out quite a lot on engaging men who are mostly as the perpetrators. But anyway, let me not go on further. Nice meeting you.
I'll give you your time, girl. Don't worry, I got you. Got you.
No, but there's a lot more to say later on. So let me
No, for sure. And the little amount of time that we have, we must kind of tell Breaking Down Borders Africa that, I mean, really, how do we discuss such big issues in an hour? But ladies, we've got to do this. Charity, are you back? Charity? Hi, Charity. So Charity's frozen again.
Yeah.
Okay, so I'm going to get in touch with the Breaking Down Borders team and just see if Charity is going to be able to join us for the rest of the conversation. But I think I'm going to then dive right in. And Thelma, hi, Charity. Are you back?
Hello. Yes.
Yay, we can hear
Can you
you.
hear me?
Yes.
Finally. Hi.
Awesome.
Hi, everyone.
Hi, Charity. Thank you so much for joining us, and we hope that the connection is going to behave so we can hear from you, because we'd love to hear from you. Charity, please give us a brief on who you are. I do know that you're a women's rights activist and you work for Oxfam. I know you are passionate about human rights in general, but I know in your heart women's rights is your thing.
Of course.
And I know that you've done a lot of work in Uganda through your work with Oxfam. You are as well a recipient of the amazing, prestigious Mandela Washington Fellowship Award for Young African Leaders. So that's really amazing. So we know that you're a young woman who does incredible stuff across continents. And we are super happy to have you on this chat today. Please tell us a little bit more about yourself and dive right into your presentation. Charity, hello.
All right.
Charity.
Thank you, Smee. Hello.
Hi.
Oh, you can hear me,
Yes,
right?
I can hear you.
Yes.
You can go ahead.
Okay. So I think you've done pretty much in terms of introducing me. I don't really want to add a lot, but just to mention is that one thing that I believe I'm born to do and I'm born for. So in every situation, in everything that I have done in my life, right away from when I was a little girl date when I'm working with activists, this is something that, thank you very much. It's a pleasure to meet everyone, across the continent. It's exciting. Yes, so I don't know if I'm losing you guys.
We can hear you. You keep coming in and out, but I think let's soldier on. Let's see how it goes. Charity?
Yes, but mine is very brief. Yes. Am I
Yes.
there?
Yeah.
Okay. Yes, I just wanted to say that, my presentation is basically looking at the impact, impact of COVID on women. On the continent, we have different people have different discussions. So I just wanted to say that, of course, women on the African continent, are definitely affected by this pandemic. There's a silent pandemic within the bigger pandemic of COVID on the African continent that is affecting women. If you look at issues around unpaid care work, women's unpaid care work, women are really subsidizing government efforts to respond to care work in terms of, looking after the households, the people who are on quarantine in their houses. The women are the ones who are doing all that work. And in doing that, you find that, of course, a lot of their productive time is lost in doing that. And of course, with the quarantines and the lockdowns, the women are not able on the continent to be able to, engage in productive work. So there's the economic question, and recently Oxfam carried out a research indicating how much time globally, but also in terms of Africa, is lost by women, and what does it mean in terms of economy, both care economy at household, but also on the continent. So this pandemic is really entrenching and deepening inequality when it comes to sharing of care work, sharing of roles and responsibilities. And this is across the continent, not only in Uganda, Mozambique, Kenya, all of us, and I'm sure different people will also give us their own perspectives. I will not go into statistics because they are glaring, and studies have been carried out by different organizations. Secondly, there's the issue, a bigger issue around leadership. I don't know in some of the countries how it is, but in most of the countries that I've seen currently, there's the issue of women not being on national task forces for COVID pandemic responses. Or if they're there, maybe as not really as active agents, but they're there as recipients of orders and directives. if you look at the African continent, even in terms of women's political participation, we have less than 24% of women who are CEOs, women who are in the private sector, women who are in parliaments, women who are in cabinets, and this pandemic is further exposing that we have a lot of women's voices not being represented on national task forces. So that's one major thing that we as African women, we want to see the current response being informed by women, not only numerically, but in terms of actual input. Then we also want to see gendered processes in terms of COVID, and that's because their absence is because the women are not there, they're not on those response task forces. We have issues around women's health. Yeah, we know that women are the front line in terms of response. And that seems like I'm contradicting, but in terms of caring, but also in health, yeah, we have over 70% of women who are in the health sector that are responding to this pandemic. But in terms of actual access to health services, for example, sexual reproductive health services due to the pandemic and lockdowns, and also issues of accessibility and the lack of funds to access these services, issues of affordability, we still have a big question around access to services such as sexual reproductive health services. And we know that on the continent faces highest rates of HIV/AIDS infection. And this is very high amongst young women due to transactional sex, amongst other things. Yeah. And we know that this is the time that women need those services. For example, due to the lockdowns and quarantines, maybe the issue around sexual reproductive health is a huge one on the continent. Yeah. You're going to have, unplanned pregnancies, and of course we know the issues around power relations. Maybe the women cannot negotiate for safe sex, but even if they negotiated the issue of accessibility of services for family planning, for all that. Yeah, so it's a big question that needs to be addressed in this COVID pandemic. And in one of the studies that was carried out on the continent, we find out that there's limited the health facilities or health infrastructure in Africa is not ready to give those services to the women. Yeah, so it's a two-way. The services to the health. African governments are trying to respond. They are looking at actual COVID, in terms of PPPs, those masks, sanitizers and all, but they're not looking at actually equipping the human equipment in terms of family planning services, contraceptives, etc. They're only looking at, of course, the so-called life-saving, but I believe life-saving should be holistic. So our African national task forces need to do that. Then there's the issue around GBV, and my sister talked about her work around GBV. It is still, actually, it is the big pandemic within the pandemic, because we know that the lockdowns, the quarantines, yeah, they're further entrenching the normal, the social norms, because now families now are probably all together, the extended families, and you know what it comes with, so there's a lot of the practice of negative social norms of around gender roles, who's supposed to do what, another issue around marital maybe rape. Issues of sexual violence are really, they cut across all what do I say it? Maybe all forgetting the word, but it's something that is really, really big. So, for example, in my country, or even in our neighboring country in Kenya, and my sister from Kenya, I think I saw her online, she'll tell us how, for example, out of a third of all the crimes related to COVID that have been received during this pandemic were due to sexual violence, while in Uganda we have over 300 cases reported of domestic violence and GBV related during this pandemic. Just within 2 months, we have over 300, and those are the reported cases. So to sum it all, I'm saying that on the African continent, we have to think through our interventions as national governments in response to the COVID pandemic. How are we responding? Are we responding in a gender sensitive manner or gender transformative manner, or are we gender blind because we need to address this big question around women's rights on the continent during this pandemic? Briefly, that's what I can say. I hope you are able to pick me because I feel like I'm breaking and
Thank you so much, Charity. Yes, at some points it was difficult to hear, but definitely we heard bulk of it. And it was amazing how you spoke about, you've really given us an overview, a continental view of what the challenges are, especially in the areas I spoke about, being gender-based violence, access to healthcare services, as well as economic well-being. And as I introduce my panelists, Charity, you've done a really great job in delving deep into each of these topics. And what I love more than anything is that I think these three topics within this topic is really, they're really the silent, like you said, the silent pandemic within the pandemic. And this is a pandemic as activists have been dealing with for many, many years. And like you say, a situation like the one we find ourselves in just further exacerbates the situation. And we've got to get to a point where we are cracking in on how do we come out winning at the end. Before I introduce my panelists again to give them a chance to chat, I want to say hi to everybody. I want to mention people by country names so that I hope I don't leave anybody out. We've got Burundi here, Madagascar, we've got Nigeria, we've got Cote d'Ivoire, Tanzania, we've got Kenya, Jamaica, we've got Ghana, we've got Namibia, we've got Botswana, we've got Zambia, Africa, and we also have, wait for it, Taiwan. We've got Taiwan here as well. So welcome, everybody. Thank you so much for joining us. We see all of your messages, and as soon as we've got time at the end, we'll take some questions and we'll get the panelists to respond. Now, I wanna chat to you quickly, Denai, around limited health infrastructure, which is what Charity spoke about. What has been your experience in pre-COVID, during COVID around this, and how are women and girls mostly affected by limited health infrastructure and services in general?
I think, the healthcare system in Africa in general has always been, problematic in that it's not well equipped to deal with a lot of the challenges that, women and children, especially young girls face, right? So what you would find is that, if you're a young girl and you want to go to a healthcare facility and speak on, getting reproductive services, you often face things like, stigma and, stereotypes that are attached to that, right? You often get criticized of, why is it that you're participating in sexual activities? You're supposed to be young, you're supposed to be in school. On the other hand, you find that there are a lot of young people, especially young girls, who just don't know, right? They don't know, what to do if they're in a particular situation. They don't know if they are experiencing certain symptoms, that this is what it means, and this is, where you need to go to consult for help, right? And I think what COVID-19 has done is that it's exacerbated it. in the sense that the limited access that young women and girls had in terms of healthcare has now been restricted quite extensively, in the sense that, there's been a restriction of movement. So, while you would have been able to easily go to the facility that's maybe down the road from you, you are now more cautious about going, because you're like, okay, if I go to that facility, there's a chance that I might contract COVID-19, right?
Yeah,
and the media around it has framed COVID-19 as sort of like a deadly virus, right? So you become hesitant in going to those facilities. Meanwhile, like, you as a person, or you as a young woman who is in desperate need of healthcare services, you become reluctant, and you'd rather stay at home and not get checked out, because the media is saying, and the current chat is COVID-19 is this really big pandemic, everyone must stay at home. And I think that's the mistake that we might have made as a society, in that when we speak about COVID-19, we don't frame it in such a way to say, look, yes, COVID-19 is this particular is this pandemic, but it doesn't necessarily mean that you must stop visiting healthcare facilities. It doesn't necessarily mean that you must stop seeking for help, especially if you're a young girl who needs essential sexual health, information.
Right. No, I mean, I think you've hit the nail on the head. Is that I think it's being caught between a rock and a hard place. On the one hand, you want to access, like Charity said, because we're going through a pandemic doesn't mean that the ordinary health services like family planning, getting your contraceptives, or getting condoms from the clinic, you should be able to still access that. But on the flip side, you do know that if you're going to a healthcare facility right now, you might be putting your life at risk. And so then my question would be to Thelma, if Thelma is still with us.
Yes, I'm here.
Great. How do we navigate between, and this is going back to me wanting this conversation to be equally problems as well as challenges. How do the young women and girls then still find it or have confidence to still go through to a healthcare facility that we know probably doesn't have the capacity or the right infrastructure to withstand the weight or the heaviness of what's happening now? But how do we then still say to young women and girls, go? It's still your right. You still have to go. I mean, for example, here in South Africa, we've been in lockdown for almost 2 months, and we are fearing a sexual behavioral spike that might happen from being in lockdown for almost 2 months. What do you then do? Do you then say, are you still able to get your condoms? What are we saying to young women? What must they do during this time?
Okay, so first of all, I think let me just add on to what Danai has said on what's happening exactly at this point in time in hospitals. I mean, yes, it's unfortunate that there's been a shift of concentration from the usual, maybe even like for you to get a malaria drug when you have malaria, it's become hard because now even the same health workers are actually being used to respond to COVID patients. And at the same time, most of them don't even have enough protective gear and things like that. So when it comes to accessing sexual and reproductive health rights, it's been a burden. And definitely we have to expect a spike in population, and we have to expect a spike that will come about with early pregnancies. It's something that it's mostly actually disheartening. And at the same time, COVID has also come with its own myths and misconceptions about how, like, mostly to the males, how it's affecting the testicles and issues of that. So those things. So there's a lot around just what men and young men do struggle to.
We're losing you a bit, Thelma. Thelma, we're losing you a bit. Do you want to just check your connection again?
Oh yeah, great. I can hear you though. Can you hear me?
We can hear you now, yes.
Okay, great. Okay, so I'll keep on. So I was just talking about how there's been a shift in concentration in terms of our hospitals, in terms of almost all services, in terms of sexual reproductive health. But what can young women do, especially, and what can adults and girls do as well. And at this point in time, let me also highlight how like there should be a high view, because there's a lot of free time. People are just staying idle at home, and then they're maybe closer to their loved ones in one way or the other. But one thing that is, first of all, are the services available? I think this is also a question that we really need to ask ourselves. Are the services available mainly online? For instance, like, can you hear me?
Yeah, go ahead.
Great. Yeah. So there are several civil society organizations which have partnered with healthy service deliverers to provide an online service. For example, if you need a condom, you text a certain WhatsApp number and then they drop it at your door, just like the way it's been done with food. But I feel like there's still that large gap, because even most of them, how about those that do not have that access to, let's say, an online platform? It's also a very big gap. But I've also seen how like people are going door to door to deliver food and other resources and things of that sort. But we're also remaining with the sexual reproductive aspect of it, even menstrual, in terms of menstrual hygiene. I feel like not even a lot of young girls have access to pads or anything at this point in time. So I feel like as civil society organizations, we should be able to partner with the healthy sector, so that we can work hand in hand and deliver maybe door to door to those who are in need. At the same time, it doesn't even have to be those who are in need, but almost everyone is at need. So the same way we're actually delivering food from one door to another, it should be something that we should be able to take up on. And at the same time, I feel like we're not raising our voices enough to demand these services. I feel like everyone is scared at this point in time, and maybe when you try to shift the conversation, everyone will be like, why would you want to think of having sex when you're supposed to, not to be in contact with the person? But these are bodily needs. These are bodily needs that almost everyone will need to respond to. So at the same time, I feel like we're not just doing enough as people, as who's supposed to be pushing.
Go ahead. Sorry, go ahead.
Enough, we're putting our voice to get harmony to push for us. We have the right, but are we demanding to have that access? So I feel like, they should continuously work together, collaborate, and continue raising our voices. Because if we don't knock on these doors, who will open these doors for us? So first of all, I would say, yes, we need to deliver to those in need. And at the same time, we need to continue advocating and lobbying for these services, even at this point in time. We shouldn't completely shift our concentration and our paradigm from the usual to COVID-19. There are a lot more, and there's actually going to be something that will hit us even harder if we just keep quiet now. Right. So I think, that's what I
definitely do agree with you on the fact that though we may respect that we are all going through a pandemic, we've always had a silent pandemic, like Charity said. And so we mustn't lose focus as women activists. We must stay on it, respect what's going on, but be like, you know what, we still need services. It's a very interesting suggestion on our comments that I will get to. But I think what's most important now is that we've also got to be creative around what do we do in a pandemic and how do we ensure that services still continue even during tough times. Hayat, I want to get to you now, and I want to chat about. Thank you so much for that, Thelma. Hayat, I want to chat to you about economic well-being. Charity touched on it on a wonderful presentation around almost 70% or around 70% of frontline workers are women. Okay. Mm-hmm. Yes, we talk about the fact that women, it's a bit contradictory, and I understand why she said that, because we also complain a lot, to talk a lot around women don't have access to economic opportunities. And right now, almost 70% of them are on the economic front line. On the front lines of the pandemic. How has it been like in Algeria pre-COVID, and what's made it worse now during COVID? And I'm talking about economic well-being or the access to economic opportunities in Algeria. How has it changed, if it's changed at all?
Mm-hmm. Okay, well, actually, thank you so much for this question. It's a really great question because, today in Algeria, like, I don't know if are you hearing me?
Yeah, loud and clear.
What about the picture? Everything is okay?
Yeah, it's good.
Okay, so I was saying that today in Algeria, like everywhere else in the world, women are at the first line of defense against this pandemic. Okay, whether in the at the economic side or the healthcare side and stuff. So they are risking their lives and sacrificing them to public health or to public, let's say, benefits. Talking about the economic sector or the economic chances, we know that some of women before this pandemic were living, let's say, a day-to-day random, let's say, salaries or small jobs. So we do have a lot of examples here in Algeria that a lot of families depend on one and only salary of that woman or one of this how do we say the
Did you just drop off the conversation? Deny?
Yeah, I think she did.
She
Yeah.
I think she touched something and okay, so while we wait for Hayat to come back, we'll see her when she's back. Just back to you, Thalma, really quickly. I know your key area of involvement is gender-based violence, and have you seen that in Malawi it's gotten any worse during this time?
So for starters, Malawi is actually in a bit different situation. We don't have like a heavy lockdown. Of course, it's been a lockdown. Movement is kind of minimized and things of that sort. But yes, and at this point in time, we don't really have the statistics on how much it has increased. And sometimes, looking from our work, the work that we generally do, it shows like it's from observation. It's still showing that gender-based violence has increased. So anyway, just to follow up, what was the next question? But yeah, definitely it has increased, especially, or let me just highlight this, especially on issues of child labor. It's something that there's a lot of exploitation of adolescents, both girls and boys, because it's a festive period and they're out of school, so most of them are being exploited in fields and issues of that sort. So I think just to get back to your question,
No, I think you've answered it. So for me, I just wanted to understand, and it's interesting to hear that. I mean, we assume when it's tough in South Africa as it is right now, that it's the same throughout, almost at same levels. But it's interesting to hear that you guys are not at the heaviest of lockdown/quarantine levels, but and you don't have the statistics, but you still have a gender-based violence issue. And should you guys get any worse in terms of your levels, that will only get worse too. That's safe to assume, right?
Definitely.
Okay, all right. I do want to chat quickly to Charity and understand what are some of the new ways or innovative, creative ways where you've ensured that young women, if at all, are remaining in the system, be it in a schooling system, be it basic schooling system or tertiary education, or remaining in the system of being employed during this time. Are there any particular suggestions, ideas, innovative, creative ways that you guys have made sure that stays the same? Charity? Charity not here.
Yeah.
Okay, I'm gonna move on. So I'm gonna quickly just want to focus on some of the questions that we have here. Denai, a question somebody posted here is, why are we not focusing, because of the fact that we want adolescent girls and young women to still access healthcare services, why are we not putting a little bit more effort on mobile clinics?
It's a very interesting question. And it's a question that I think, those that are working in the healthcare sector haven't thought about. I think we're still stuck on, the brick and mortar of the facility. And I think maybe this is the right time to actually start thinking about moving away from having, a fixed facility and start focusing a lot more on, mobile facilities. Because I do think that, maybe part of the reason why, you know, some of these services aren't accessible is the fact that they are fixed. And, you know, people in remote communities aren't able to travel long distances to these healthcare facilities. I will definitely, I think on my part, you know, raise it up with some of the stakeholders that I have that work in healthcare sector to, you know, ask them, you know, is there not a way for us to ensure that young girls and young women especially continue to receive the necessary healthcare that they need, and the educational aspect of it in the form of a mobile clinic. So I really do appreciate that comment, and I think it's one that is definitely relevant in a time like this.
I think so too. I do think that it requires all of us to think outside the box. And I think for the services that we're talking about now, and Charity touched on, they're basic healthcare services, and it can be done outside the brick and mortar vibe of a clinic, and really requires all of us to you know, put our thinking caps and our heads together around what's easiest. Of course, when you look at various parts of the country, that it's rural and peri-urban, and you want to also make sure that whatever mobile clinic there is reaches all corners of the country. The other question that came up was around young women. Schools have been closed, and of course we anticipate that teenage pregnancy will rise, child labor will rise, and child marriage might also rise, because parents, just to shed off the responsibility, might put their children through that. We already have over 130 million children out of school. Thelma, how do you think this is going to make matters worse, if at all? We have 130 million outside of school now. I mean, it's going to get worse, for sure.
Yeah, definitely. No, definitely. And actually, it's more like a drive now that, like I spoke earlier on the idleness, you know, they're idle, they're at home, they have so much free time. And most of them, especially from senior primary up to, let's say, senior secondary, most of them are age where onto their at the same time. This is also to in my work, I've already registered 3 where I've home, either get married or just cohabit. So yeah, definitely this is about to become rampant. Firstly, yeah, when it comes to that idleness, and then the sexual debut again. And secondly, also the economic pressure at home. I would like to put it this way, like there is a war at home. Most of them are stuck with their perpetrators and they want their freedom and they will run off. And also at the same time, most of them are at a point where they don't have enough food resources. So even marriage can be a form of a transactional marriage is about to rise as well. And at the same time, it's also a thing for parents to say, go fend us food. You know, so like I would say, most, even like, I don't know if it's also the same in other countries, but most domestic workers have lost their jobs, and then we're looking at even parents who are like in the informal sector, in the informal economic sector, who are not selling on a daily basis as the daily breadwinners. So in terms of the economic aspect, it's also a major drive to child marriages, which is bound to rise. So at this point in time, I would say 3 have already been reported, as I'm aware of. So by, let's say, August, it's definitely bound to increase with the economic pressures, with the sexual debut, with the need for freedom, and also the social capital that most would think they would build in a marriage setting. It's also something that is missing. So yeah, definitely being out of school, it's not just the cognitive development, but we're looking at the daily support from peers and issues of that sort, and also just being occupied with schoolwork, and now they're idle. So there are a couple of factors that are surrounding towards this, but definitely, it's definitely going to spike again. We were moving forward, but now I feel like we definitely will move like 6 steps backwards.
Thank you so much for that, Thelma. We have a participant, April Ripley, who is on fire here with her questions. And Charity, I almost want Charity. Are you here with us?
Oh yes.
Okay, so I've got a question from April, whom is really active on our conversation. So thank you so much, April. Shout out to you. And Charity, her question. I mean, she's got a few questions there, but I mean, one question that has hit me there quite strongly is, why is it that it seems like the world doesn't care about us? You know, women are out there risking their lives every single day. And why is it that when we are saying, hello, no, this is hard, no, this is not working, our cries and everything else falls on the ground and nobody pays attention? Why is it? Is it that way? Is it because we are naturally taking up our role to be caregivers and, you know, the ones who gives love and development in communities? But why is it that when we scream and shout for attention and help, it takes us years and centuries to get attention?
Thank you. That's very interesting. Yeah, definitely. I agree that, and if I'm to give the context of Uganda, for example, we have a marriage and divorce bill, which is supposed to kind of bring all the marriage laws into one to protect men and women. So that bill is older than all of us, maybe for 60 years. It has really been pushed, and one of the reasons why it can't pass, because it has the face of a woman. It's the women who are making noise, apparently. It's the women who are home wreckers and home breakers who are pushing it. So why am I saying this? I think one of the things that we as activists need to think through is the facing and naming of our narrative, what we want to be changed. How are we putting it out there? One, if you put it there in a very confrontational way, sometimes people say that's an issue. Again, when you gloss over it, again, that won't help. So we need to find a way in which we can present our messages and our facing and naming. How do we public facing? Are we passing off as very angry women who are saying, this is a big pandemic within a pandemic, and people are like, okay, here they are again? Or how are we need to show what is the world losing by neglecting these these women, the women who are who are like 80% supporting actually this pandemic in a way, in their subtle ways. So probably we need to show that the question of merits and demerits, we show what we are losing and what we can gain by engaging women, or by bringing the question of women to the world. That way we'll get attention. And of course we have to talk with evidence, with a lot of human stories, a lot of quotes and all. The second question, where I'm thinking the world is not caring, of course all of us are products of socialization, patriarchy. It is, and probably they will not care even during my children's children. So it's a question that we have to again try to speak truth to power, and in all forms of, power at all forms rather. So and it starts from our households, the community, to the level, to global and all. So issues around patriarchy, and which we, the young women and young men, have the role to make sure that we start to bring this question now, so that our kids don't face the same issue. So issues around patriarchy, socialization, but also how we face and name our activism is very important. My colleagues, I'm sure, can add. But briefly, that's what
and
I can say.
Yes, can I add? I just want to add on that, on the same. I just want to add on the same. Yes, Charity, I definitely agree with you on who is, on how women are mostly taken, looked into. But lest we forget, there are a couple of countries which are women-led, and have done so much and so greatly in responding to COVID-19. They're flattened the curve. So I feel like, as Africa in general, one thing that I'm missing, and it's also something that was highlighted from the beginning, is the representation of women in these spaces. In the spaces of decision making, in the spaces of stakeholders, let me just say in leadership positions, which are the most influencing parties. So I feel like we're not doing much. We're not doing well, more like in terms of women's political participation, in terms of leadership in almost all the private and public sectors. And this is a thing that is really, really highlighting the gaps that exist in terms of gender equality in all our countries. And we can see, I feel like even COVID-19, we should learn something from it when it comes to women's leadership from all these countries that have flattened the curve in very few months, but they have done so well. For example, New Zealand, Iceland, they're doing so well because there is a woman up front. Even the states, some of the states in America, they're doing so great because there's a woman who is there. So I feel like we're missing a representation of who understands of what that care work brings about. So yeah, I think that's all I wanted to add. Let me not take much of it.
And I think what you and Charity, Thelma, are talking about is really handling patriarchy. That is a concept that we all need to break down. Define masculinity and what it means, and without taking anything away from any gender, But how do we navigate and work around the fact that no gender must definitely be suppressing another? And I mean, somebody said it here. They said, well, that's because women are nicer beings and creatures. I don't know. I don't know. That's up for debate. But Hayek, thank you. Welcome. You're back. We missed you, but that's
pissed off. I just wanted to manipulate something to lock down. Oh my god, I'm really
Hayek. Look. We are all We are all new to the space. We are all soldiering along. It's part of us being creative and thinking outside the box. We're glad you're back. I just want to give a shout out though to Bangladesh, Sierra Leone, Rwanda, Lesotho, Cameroon, who have also just been sharing some of their issues and some of their challenges that they're having. Thank you so much, guys. We see it all. But because we are going to be running out of time, I do need to wrap this conversation up. And I'm going to go back to all my panelists. And I want you in your closing statements, guys, to talk about what do we do going forward? Okay, somebody on one of our chats said, they just need to know what do we do? I think the name is Vera from Cameroon, and they really just want to know, what do we do? What do we do? And so I'd like all the panelists, and I'm going to start with you, Denai, to just tell us, what are you going to do? What are you going to do during this time? And what are your suggestions and your ideas that people can also implement in other parts of the world?
I definitely think that, we need to be more intentional about, how we speak about issues that affect women, especially now during COVID. I think definitely, like in my own personal capacity, I think one of the things that I've been thinking about, and I think it's something that I'm definitely going to implement after this, is that, when you're talking about COVID, you also talk about how it's affecting women and children. When you talk about economic issues, you also talk about how women and children are being affected by it, right? When you're talking to people and saying, hey, don't forget to wash your hands, also talk about, how is this impacting young women and children? Because I think in having that kind of conversation where you're inserting women and children in every issue that you speak of or every issue that you encounter, you begin to realize just how everything affects women and children in a particular way. And then in terms of, how do you then find a solution to ensure that, women and children aren't marginalized or continue to be marginalized, especially during this time, is, I think, from a policy level, definitely one of the things that needs to happen is that women and children needs to be a standing agenda when, when politicians and government officials are talking about COVID response. And that agenda point should filter all the way down to various organizations that are doing a lot of work in terms of COVID response. So, when you talk about distributing food packages, you should also think about, okay, how do I ensure that young women and children also get this message as well? Because I think in doing that and being that intentional, that's the only way that we'll be able to ensure that, women and children do not continue to be marginalized during COVID.
Great. Thanks, Tanai. Heard that loud and clear. Harriet, what are your thoughts?
Well, according to me, all our efforts as feminists, gender equality activists, or whatever we do have that position in the society, must be unified in the form of a single major force to be able to have more weight and scope in our demands. I think that I do believe that today, more than ever, the danger is at its peak. And the government, according to me, must take a full responsibility to respond to these issues through measures, through laws, to protect and ensure a better future for women, and even, I mean, at least a better daily life for every single woman or every single girl. For me, I know that in my country, for example, every single feminist activist or gender equality activist or human rights activist or whatever, the efforts that are being done, I mean, actually they are, and it's, I mean, amazing work is being done, really. But I think that in order to have that one unified major force, in order to practice pressure on the government and to have response, sorry, in return, we have to have that, let's say national or regional scope in order to have a response. I don't know if you get me or not.
Yeah.
But the thing also is that if I can take an example, a polemic happened in Algeria because of a doctor death, Dr. Boudissa, and the thing is that, I mean, the polemic was really at its highest standard here in Algeria, but nothing, I mean, without any real security measures were taken from the government to ensure proper decent conditions for healthcare workers and the entire medical sectors. So for me, it's a great example to say that according to all the, or let's say, taking into consideration all the problems that we're facing, if a political will is not in place, I think we could not have that kind of, let's say, efforts gaining, if you see what I mean. I really do believe today more than ever that we should have a united or unified force that could constitute that pressure to have measures, to have laws that could ensure a decent life for women and young girls.
Thank you so much, Hayat. Got that. Definitely. Thank you so much. Thelma, what are your last thoughts? What do you think we should be doing? What are you going to do? Thelma? Thelma?
Hello.
Hi.
Yes, I'm here.
We can hear you.
Can you hear me?
Yes.
Okay, great. I just had to turn off my video. I'm sorry. So first of all, let me start by highlighting that actually somebody said that women are quieter, meek, and the like. But let me just start by highlighting that actually gender expectation or a gender role is something that comes about performativeness. Because as Shahid already said, I just want to highlight this because of how we socialize, because of how we're traditionally tied to our roles. This is why we are told to keep quiet more often and issues of that sort. So thanks to COVID-19, which is highlighting these gaps actually that are existing. So first of all, yes, somebody's mentioned in the chat that this old society of thinking that women are weak. Women are definitely moving forward and breaking the glass ceiling. We have seen it now, and we're yet to see it even more. At this point in time, I should also highlight we're here, there's no work without women being involved. There's no work that can be done. One of the preventive measures, which is actually the most highlighted, to wash our hands. But how many households have access to that water that they can wash their hands every, for 60 minutes, for 60 seconds or something of that sort? It's the same women who have to walk longer distances to go fetch the water to bring in their household. It's the same women who also have to take care of those who are sick at the, the same women who are constantly working day and night as nurses in the healthy care systems. So there will not be any work that will be done if we actually leave out women out of this conversation, and if we actually leave women out of the woodlock, as we always do. So yes, definitely, women are consistently being left out, but there isn't much of the work that is being done. What's stuck with the same patriarchal societies, we're stuck with the same patriarchal leaders who are so power hungry, who are greed. You know, some of them even embezzling money that is supposed to be used for the response services. What are we doing, you know, just to provide that service to a mere woman? So at this point in time, I think moving forward, I'll say this again, as young women activists, as young people, collectively, we are the generation to change what's bound to happen. Actually, let's look at COVID as something that is washing off almost all the social ills that exist, including gender inequalities. So moving forward, we as young people, I just want to encourage each one and every one of us that we have the power to change the existing narrative. We have the power to change the existing desire we have seen in women and children. I would say whether it's
Thelma, you're breaking up.
Oh, sorry. Can you hear me now?
Yeah, that's fine. That's better.
That's better. Did you hear the first part?
Yes. Yeah. Yeah.
Okay, great. Yeah. So moving forward, I feel like we should still, yes, continue to just keep on moving forward and moving together. Yeah, so I think finally, and also I should say that even in our conversations, if we want to reach out to households, let's look at households, maybe women-led households. There are more women-led households, there are more child-headed households. Are we reaching out to these, or we're just going generally to the vulnerable ones? Even, you know, because what's happening is, even though we're reaching out to those households, there's also a power imbalance that exists at the level, which will not even, you know, cause more women and more children to even get the few resources, and whereby men have to, you know, just scramble for more. So at this point in time, we really need to be gender sensitive in our responsive services, and at the same time, let's just keep on working together. Thank you.
Great. Thank you so much, Thelma. And I see we've lost Charity, but Charity has sent us a message, and she says, you know, we've got to also start working alongside media to be able to make sure that we analyze those at all levels. And we know media is a powerful tool for us to be able to do that. So that's for one from Charity. And secondly, Charity saying government care adequately to address the deepened inequality caused by COVID-19. And it must not be a reactive response. We know what's going to happen post-COVID. And so governments, while of course focusing on life-saving strategies, have also got to start thinking about what happens after COVID and be proactive around some of the deepened issues we know we're going to deal with, like the rise of teenage pregnancy, the rise of HIV infection, the rise of gender-based violence. We already know that these things are happening. And so what are we doing about them? Guys, we need to wrap this up, unfortunately. And what my panelists have said really have kind of hit the nail on the head. You know, we, as Denai said it, we must be a standing agenda, is what I quote from you, Denai, is that throughout this entire process and even after this, we must be an agenda. We must be on the agenda, part of the agenda, with every single thing that we're going to be talking about through this time. And hey, you said, and you said we must be unified while doing that. You know, let's make sure that our messages from all around the continent, we find where we meet each other halfway and we become unified in that. I think we are all clear that we're going to have challenges after this, and so we've got to be unified in the response. And Thelma, what I take away from you is let's break the glass ceiling. We are the ones as women and girls who've been breaking that ceiling, and we are strong. As somebody in our comments said, women are strong and we can do this. Of course we're going to get through this, but we have got to have ways in which we come out of this stronger and better, not only for ourselves, but for the continent as well. You know, the truth of the matter is that this is probably the biggest humanitarian crisis since the World War II. And young girls are still subjected to genital mutilations. Girls are out of school. There's so many crises we've had before this crisis. We've been fighting, you know, and so we've got to really, like you ladies have said, have a unified approach and be on the agenda constantly and fight for it. The truth of the matter is, as Charity mentioned earlier, women do the majority of the work in the world, and yet have this much fraction to the world's money, and less, and even less of them and less of us have earned the right amount of money, or even have property or land to prove for it. And so we are the ones, along with all our activists from around the world, including the USA, we have to do this, guys. We are the ones who can be responsible to do this. We can't sleep now. Now is COVID. Girls and young women around the world and on the continent need us now more than ever. I wish you all an amazing journey as you navigate in your spaces COVID-19, and we rely on you to have a proactive response and reaction to what is going to happen post-COVID, because that is when all of us are going to be needed the most. Thank you so much, and I hope everybody had an amazing conversation. Thank you, ladies, and thank you to PTA.
Thanks, everyone.
Thanks, guys. Bye.
See you.
Thank you.